legs. So as you can see, you have 4 brackets here. One shows your hip activity, hip left, knee left. One's for, of course, the right leg, hip right, knee right. So you have the lines that indicate your swing phase, the orange lines, and your stance phase. So swing phase basically is when your leg is going through the motion, and your stance phase is basically when your leg is being loaded onto the treadmill, so when it's bearing weight. So swing and stance. This then shows the levels of activity or strength being applied when swing and when standing. So everything that's at level, that says 0, is the same strength as the locomote is providing. So basically, if your swing is at 0, that means, or below, it means that you're producing basically the same strength as the locomote. If it's above, it means you're stronger, then you're applying force. If it's lower, it means the locomote is pulling you. So it means you're actually generating less force than the locomote, or you maybe have some muscle tone and it's sensing some resistance to the movement. So that's when you go into negative values, is when the locomote senses either resistance or no movement. When there is certain movement or your legs are loose enough, it will be at a level 0, or maybe slightly above if you can follow along. So everything that's above, so you can see the knees. So this, again, sometimes there could be extensor muscle tone involved as well. So sometimes when your leg extends, it could lock up. So there could be these high values. These usually such high values means it could be muscle tone. If it's somewhere above, like here, around 80s, 40s, that's more voluntary tone. So it could be you doing the activity. Anything that's constantly like high, up. So this right knee, I think it's locking up. It could be that there's some tone involved, or you like really trying hard and maybe locking it in place, and then the locomote can't provide any more assistance because you kind of lock your leg in place. So you can kind of follow along everything and try. I would suggest following one segment at a time, like checking your left hip, try to focus on that left hip through swinging and standing and seeing how it reacts. And kind of doing each of those in segments. And then with time, of course, when you get used to it, the thing is, you have to get used to the feeling of walking in this device, because of course, it's unnatural. For the first time, everything's kind of weird. You kind of have to get used to the motion, the movement, again, being verticalized, being in the standing position. Everything is kind of maybe off of it. So I wouldn't even bother with these, especially in the first, second session, maybe just even the first week. What I want you to do is kind of just feel what's going on. Feel the locomote. You have the mirror here, look at yourself, look at how you're walking, kind of try to perceive the motion, the movement, and then try to kind of emulate and follow along. And then with time, we'll get to these numbers, because like for the first week, I just want you to feel comfortable using the device. After that, we can go into some more complex stuff. For the beginning, I just want you to feel good with it, okay? But again, you have some good values. There are some pluses. These high values could indicate muscle tone, locking up. So again, maybe the legs need to relax a bit. Again, the locomotor is sensing some strain, but with time, it'll get better. So just take it easy, keep walking, and you'll do good, okay? Yep. Any questions? No. Good. Just